Hi, I'm Bela Matyas. I'm the Solano County Health Officer. We've been getting a lot of questions lately around social distancing, the orders that were issued by a number of the Bay Area counties, and issues related to that. So let me go ahead and remind all of us what we mean by social distancing and why it's important. So again, this coronavirus disease is spreading from person to person through droplets. So what that means is that if I'm coughing or sneezing, I'm able to spew out a lot of virus, and people that are close enough to inhale it or have it land on their face are potentially going to be exposed to that virus. But I'm also able to pass the virus without coughing and sneezing. I can pass it through my hands, for example, by touching my face, my mouth, my nose, having the virus get onto it, and then I touch you. So how do we protect ourselves from that? And the answer is that if we are sick, if we have coughing, fever, shortness of breath, if we have symptoms that are consistent with this disease, then we need to stay home. We need to separate ourselves from work, from school, from our neighbors, from our friends, and to the extent that we can, from our family. Now, it's not always easy to isolate at home, and we can give people guidance on what to think about on a case-by-case basis if you have questions about how do I isolate myself in my home. But the idea here is that if you don't bring your illness into the workplace, if you don't bring it outside of your home, you're reducing your ability to spread that way. So by contrast, if we are interacting with other people, and they're not coughing or sneezing, then we know that the only way they can transmit to us essentially is through their hands. It's through intermediate objects like the hand or surfaces. So they're not going to cough or sneeze on me. That means that, if I keep distance and I never bring my hand to my face without first washing it after I've touched surfaces or other people, then there's no way for the transmission to occur. So this is important because we're hearing a lot about asymptomatic transmission. We hear about the fact that people with mild symptoms can transmit, and that may probably be true. But the problem with it is there's nothing we can do to identify who might be an asymptomatic spreader. So we have to assume a universal precaution approach to interacting with people. And this is made much easier if people don't bring coughs and sneezes into the workplace, for example. If people without coughing or aren't coughing and sneezing, then it's much easier to control that transmission to us, because what we need to do is don't touch each other any more than absolutely necessary. Don't touch surfaces or if you touch surfaces or people, don't bring your hand to your mouth or to your nose, basically not to your face, until you've washed it or used a hand sanitizer first. So that is the way that we break the chain of transmission for situations that don't involve people actually coughing or sneezing into our face. And that works for all the respiratory diseases all the time. So it's not just for novel coronavirus, it's for all those other diseases that are out there. And if we develop that as a behavioral habit, we protect ourselves year in and year out. So again, while a person with symptoms can spread more efficiently, even if we assume that people without symptoms can spread, as long as we assume that everyone we're interacting with might be such a person, the way we protect ourselves from that is through these basic droplet precautions and things called social distancing. So what social distancing involves is physically separating yourself from people to the extent that you reasonably can. That means that in the workplace, in social settings, you stay 6 feet apart, because that's how far a cough or a sneeze will go. Obviously, if they're not coughing or sneezing, you can stand closer, but at least still stay an arm's length away from one another in case they spit when they talk. In the workplace with cubicles and offices, you're golden. Cubicle walls will prohibit the transmission of the virus through the wall. It's not going to go through the wall. Saliva is not going to go through the wall. You're totally protected. So either by distance or by being in a cubicle and or office environment, you are protected in the work environment. Now, the hardest part is social distancing outside of the work environment because of our families and our friends. And if we keep getting together with families and friends and we don't change how we interact with one another, transmission will occur. And it'll occur whether it's symptomatic or non-symptomatic, because we're touching each other and we're not controlling where our hands go after that. So the idea with social distancing is pay attention to the fact that your hand should not come to your face without being clean. And if people are coughing and sneezing, make sure that they're not continuing to do that without either leaving, covering their coughs and sneezes, putting on a mask, or some other appropriate way to control that. And obviously that's harder to do in a family environment. little bit harder with friends and extended family. But you know, to be fair, if you walk around in this workplace, there's lots of people that are pretty physically close to each other, interacting, eating together in the cafeteria, really close to each other. That's not social distancing. And those friends who you feel really comfortable with and who you're not really taking these precautions with are much more likely to transmit the disease to you than total strangers. So if you're going to employ these approaches, you have to do it universally. So then, with regard to the Bay Area orders that were recently issued by a number of counties, it's really interesting because people are describing these orders as shelter-in-place. They are not shelter-in-place orders. For those of you who are familiar with the concept of shelter-in-place, it's used when it's dangerous to go outside because the air is dangerous. So if there's been a toxic chemical spill or if there's a fire with smoke, we often tell people to stay in the structure you're in until it's clear to go out. And so sheltering in place is not the right terminology to be using for what is really social distancing orders. All that these counties have done is issue county-specific social distancing orders that mirror what the governor has already issued. If you actually look at the language of those orders, there is virtually nothing that is different between them and what the governor and the president have been talking about for quite a while. So the federal guidance and the state orders and the local orders that were issued are all pretty much the same thing. They are essentially just more detailed versions of what is or isn't out of considered essential. If you read the list of exceptions, it's very long, and very little is not excluded from the concept of don't go to work. So I think that there's been a lot of significant misrepresentation of the content of those orders, and it's unfortunate because they've been accompanied by a lot more panic and concern. And the problem is that people are over-reading the orders, they're overreacting, and it's going to potentially harm business if people are staying away from work that is essential, that is work that should continue, and it's difficult for the economy to sustain that for any length of time. It's difficult for people who may lose their own income. One of the points that's been made is that by having those orders, people can qualify for unemployment insurance. In point of fact, the governor's order is all that was needed to qualify for unemployment insurance. You don't need a local order. And the governor has more recently even removed the 1-week waiting period for unemployment insurance so that people can actually access it more quickly. And so then finally, how are we doing here in Solano County with the disease? So far, the intensity of the disease is where we pretty much expect it would be. We're not having as much intensity as some of the Bay Area counties, but we do have disease. We know that there's a lot of disease in our community. The good news is that so far, our hospitals have not been experiencing an inundation of people needing high-level care. And that's very gratifying because that's the one thing that we most have to monitor to make sure that our hospitals as a critical infrastructure can remain intact. So far, we're not seeing it. Doesn't mean we won't. And if we do, we're going to make sure everybody knows. But the whole point of the social distancing guidance by the federal government and the orders by the state are to help us try to minimize the likelihood of that occurring by having people spend more time away from one another and thereby hopefully reducing the intensity of the transmission.